Welcome, future nurses. Today, we're diving into a life or death scenario, sepsis. It's an NCLEX favorite and one of the most time-sensitive conditions you'll encounter in real-world nursing. Now, I have a challenge for you. I'll present a realistic case study, and you will make the nursing decisions. Choose wisely, your patient's life depends on it. Let's get started. Meet your patient, Mr. Robert Williams, a 72-year-old male admitted for pneumonia 2 days ago. He has a history of type 2 diabetes and chronic kidney disease. Sounds like a typical med-surg case, right? Well, things are about to get interesting. What we know so far: patient, Robert Williams, 72 years old. Diagnosis, pneumonia. History, type 2 diabetes, CKD. Current treatment, for antibiotics, oxygen therapy, but tonight, something doesn't feel right. You walk into his room, and your gut tells you, uh-oh, something's off. It's 2 a.m., and you notice Mr. Williams is suddenly confused and lethargic. His skin, warm and flushed. You check his vitals, and, uh-oh, something is definitely wrong. What's your first move? Think carefully. Choose wisely. And, no pressure, but a human life depends on your answer. If you chose C, administer 4 fluids and obtain blood cultures, congratulations. You've just taken the first critical step in managing sepsis. But why is this the best answer? Because sepsis is all about timing. The faster we intervene, the better the patient outcome, and why the other answer are wrong. A, reassess later, we don't have time to wait. Sepsis moves fast. B, call provider first, important, but we need to act now. D, increase oxygen, helpful, but not the top priority. Fast forward 1 hour. Despite fluids, Mr. Williams' BP drops to 78/40 mm of mercury, and he's barely responding. His urine output? Less than 10 milliliters per hour. His skin? Now cold and clammy. Yikes, we're in full-blown septic shock. What's your next move? If you chose a start norepinephrine infusion, nice job. We've tried fluids, and they're not enough. Now, we need vasopressors to maintain blood pressure and perfusion. And remember, time is tissue. The longer we wait, the worse the outcome. You are about to transfer Mr. Williams to the ICU when the provider asks you to start antibiotics. Which action should you take first? This is an NCLEX trap question, be careful. The correct answer is B, obtain blood cultures before starting antibiotics. This is a crucial NCLEX rule: always draw cultures before giving antibiotics to identify the exact pathogen. Before we wrap up, let's quickly review the key takeaways from today's NCLEX-style case study. Early recognition of sepsis is critical. Sepsis progresses fast, delays in treatment can lead to organ failure and death. Always assess for signs like fever, tachycardia, hypotension, and confusion. Fluids first, then vasopressors if needed. Your first-line intervention is aggressive fluid resuscitation, 30 milliliters per kilogram. If fluids don't improve BP, vasopressors like norepinephrine come next. Always obtain blood cultures before antibiotics. One of the biggest NCLEX traps: never give antibiotics before drawing blood cultures. Identifying the pathogen early helps guide effective treatment. NCLEX loves sepsis. Know the 1-hour bundle. Sepsis is an NCLEX favorite. Memorize the 1-hour bundle: fluids, blood cultures, antibiotics, lactate levels, and oxygen support. Remember, when it comes to sepsis, time is everything. That's it for today's case study. Comment your biggest takeaway below. And if you want more high-yield NCLEX scenarios, hit that subscribe button now.